Hello everyone, welcome to today's session. If you are new to our channel, please subscribe it for the daily videos.
Humerus. The humerus is the longest and largest bone of the upper limb. It consists of a proximal end, a shaft, and a distal end, all which contain important anatomical landmarks. The humerus articulates with the scapula proximally at the glenohumeral joint, so it participates in the movements of the shoulder. Proximal end. Head, anatomical neck, greater tubercle and lesser tubercle. Shaft, borders, anterior, lateral and medial. Surfaces, anterolateral, anteromedial and posterior. Distal end. Articular parts, trochlea, capitulum. Non-articular parts include olecranon, radial and coronoid fossae, internal or medial epicondyle, external or lateral epicondyle. Clinical aspects. Locations. Fractures of the humerus are relatively common and can occur at any location on the humerus. At the proximal end, most fractures are located at the surgical neck and are most common in elderly, especially those with osteoporosis. Impact fracture. An impact fracture, often the result of a humeral fracture, is where one bone fragment is driven into the spongy bone of another bone fragment. Avulsion fracture. When the greater tubercle is pulled away from the head of the humerus, the result in an avulsion fracture. It is most commonly seen in middle-aged and in the elderly. Transverse fracture. A direct blow to the arm can result in a transverse fracture of the humeral shaft. The pull of the deltoid muscle causes the proximal fragment to displace laterally. Spiral fracture. A fall onto the outstretched hand can also cause a spiral fracture of the shaft of the humerus. Endangered structures. The following nerves are located on the following aspect of the humerus: axillary nerve, surgical nerve; the radial nerve, radial groove; the median nerve, distal humerus; the ulnar nerve, medial epicondyle. If any of these aspects of the humerus are fractured, there may be damage to these nerves. Thank you all. Have a nice day.